What if the insights from this series are just the beginning and deeper resources would help you apply this knowledge professionally? Whether you're an urban planner, public health professional, policy maker, or student, the evidence-based frameworks we've discussed are available for deeper study. Today, I'm showing you where to find them and how to engage with this work beyond YouTube. Take a moment to like, subscribe, share to get the YouTube algorithms going. I'm Dr. Anthony Iyore Anaweokhai, and on Global Health Decoded, we translate complex public health research into evidence you can actually use. Before we continue, a quick note. The resources I'm sharing are for educational and professional development only. They are not a substitute for medical, legal, or professional advice. These materials support institutional capacity building and academic learning. They are not individual health consultations. Over this series, you've gained evidence-based understanding of the five major environmental health threats facing urban populations: air pollution, water and sanitation inadequacies, green space deficits, waste management failures, and urban heat islands. The mechanisms by which these threats translate into disease burden: cardiovascular impacts from PM 2.5, waterborne disease transmission pathways, mental health deterioration from nature deficit, vector breeding in uncollected waste, heat-related mortality in vulnerable populations. Proven interventions with documented outcomes: 15% life expectancy increases from air quality regulations, 153 deaths prevented annually through green infrastructure, 30 to 50% reductions in waterborne disease from community-led sanitation, multi-sectoral planning frameworks that integrate health across urban systems. Four pillars of megacity resilience: cross-sector collaboration, robust governance, community empowerment, and vulnerable populations focus. And the future of urban health: smart city infrastructure, precision health strategies, and climate health integration. We'll begin with the quote. Knowledge has value when shared freely. It gains power when applied deeply. That's the philosophy behind Global Health Decoded. Make foundational knowledge freely accessible, then provide pathways for those who want to apply it at professional depth. Let me show you what's freely available. First and foremost, everything on this YouTube channel remains free. That's 12 episodes of in-depth analysis on urban environmental health, plus future content on emerging challenges and solutions. Beyond YouTube, we maintain active communities across platforms: Instagram, TikTok, and Facebook at Global Health Decoded. Short-form educational content, rapid response to breaking urban health news, community discussions, and evidence summaries. These platforms are designed for quick learning and ongoing engagement. We also publish periodic articles and blog posts examining specific case studies, cities implementing comprehensive interventions, policy analysis, emerging research findings. These deep dives supplement video content with written analysis. Newsletter subscribers receive monthly summaries of news research, policy developments, and intervention case studies. No paywall, no upsells, just curated evidence-based urban health information delivered to your inbox. You see, education enables clarity of thoughts, effectiveness in action, and richness in life. And these free resources exist to enable all three for everyone, regardless of resources. Access to knowledge shouldn't depend on ability to pay. Global Health Decoded. That's the foundation. Now, for those seeking deeper professional development, here's where you can go deeper. This series is based on systematic research published in 4 textbooks. Let me outline what it offers and who it serves. Urban Health and Megacity Resilience provides comprehensive analysis of health challenges in cities with populations exceeding 10 million. Target audience, urban planners, public health professionals, municipal policymakers. This text examines infrastructure requirements, governance structures, emergency preparedness, and the specific dynamics of managing health in dense urban environments. Planetary health in the Anthropocene situates urban health within broader ecological systems, climate change impacts, resource depletion, biodiversity loss, and their cascading effects on human health. Target audience, environmental health professionals, climate adaptation specialists, sustainability practitioners. This text integrates urban health with planetary boundaries and ecological determinants. Health in crisis examines health system responses to emergencies. We're talking pandemics, natural disasters, conflicts, and humanitarian crises. Target audience, emergency management professionals, humanitarian workers, health system administrators. While not exclusively urban focused, substantial content addresses crisis management in dense populations. The political economy of universal health coverage analyzes financing mechanisms, governance structures, and political dynamics of achieving equitable health access. Target audience, policymakers, health economists, development professionals. This text connects urban health inequities to broader questions of resource allocation and political commitment. These are professional and academic resources, not consumer health books. They are designed for people building systems, developing policy, conducting research, or pursuing advanced education in public health and urban planning. Purchase links are in the video description. Important clarification. These books won't tell you how to treat your individual health conditions. That's not their purpose. They provide evidence for institutions developing urban health strategies. Beyond individual study, there are organizational pathways. For organizations seeking to build institutional capacity in urban health, we offer consultation services and professional development workshops. Let me be very clear about what this is and what it isn't. These services support institutions, municipal governments, public health departments, NGOs, academic institutions, international development organizations, developing urban health strategies, implementing evidence-based interventions, or building evaluation frameworks. This is not individual medical advice. It's not personal health counseling. It's not clinical guidance. If you're an individual seeking health recommendations, consult qualified healthcare professionals in your area. Organizational capacity building. What we provide? Technical assistance in adapting global evidence to local context, training for urban planners on health impact assessment, workshop facilitation on multi-sectoral coordination, evaluation framework development for urban health interventions. Who we work with? City governments implementing green infrastructure programs, public health departments developing heat preparedness plans, NGOs designing community-led sanitation projects, academic institutions building urban health research capacity. Quote this. Individual insight creates change in one life. Institutional capacity creates change at scale. If your organization is working on urban environmental health challenges and needs technical support, contact information is in the description. We assess fits before engagement. Not every request matches our expertise or capacity. So here's the value ladder. Drop a comment. Are you applying this knowledge personally, professionally, or academically? Let's understand how this community is using evidence. Global Health Decoded continues. Upcoming content includes quarterly deep dives on specific cities implementing comprehensive urban health strategies. What worked? What didn't? Lessons learned. Emerging Technology Series examining AI applications in environmental health monitoring, precision public health tools, and smart city equity considerations. Climate health integration case studies as cities worldwide adapt infrastructure for resilience. Policy analysis examining financing mechanisms for urban health infrastructure in resource constrained settings. This is ongoing work. Subscribe to stay connected. To summarize the pathways, free resources, YouTube, social media at Global Health Decoded, newsletters, blog posts accessible to everyone. Deeper study, 4 textbooks for professionals and students. Purchase links in the description. Organizational capacity, consultation, and workshops for institutions. Contact information in description. Whether you engage with free content or dive deeper, we are part of creating healthier cities. The knowledge hierarchy exists to serve different needs, from casual learning to professional implementation to organizational transformation. Choose the level that matches your goal. All paths contribute to the mission, evidence-based urban health for everyone. This concludes our urban health crisis series, but the conversation continues. Connect with us at Global Health Decoded across all platforms. Whether you engage with free content or pursue deeper resources, thank you for being here. Your urban health matters. Make it count.